Hey, good morning, and welcome to Inside South Florida. I'm Dave Azer. Today, whether you're a scuba diver or a swimmer or both, we've got a specialist here with some tips on how to keep you safe underwater. Plus, we'll tell you what the Boys and Girls Clubs of Miami-Dade are doing to keep your kids thriving throughout the summer, and you'll hear about a device called the AtraClip. If you don't know much about it, it could save your life. That and more as Inside South Florida starts right now. Lobster mini season is upon us, and some of you will be jumping into the water with almost no dive experience. Here to keep you all safe is Dr. Daniel Grobman, sports medicine specialist with Cleveland Clinic, Florida. Dr. Grobman, it is awesome to have you here, man. How are you?
Thanks for having me. I'm great.
So this is going to be really interesting. I mean, obviously in South Florida, so many people swim and dive, and we're going to talk about how to stay safe while doing both. Let's start with diving. Lobster mini season is upon us, and you know, as you and I both know, it seems like every year people get injured. Sometimes people die. So let's start with that. So for people that are taking part in that, what are some of the major things they need to be aware of when diving?
Well, in mini season, obviously there's an abundance of divers that want to participate, and you know, certainly some of the general health issues that an individual might have, whether it be their background medical history, asthma, diabetes, high blood pressure, can all play a role in the diver's ability to participate. So from a general health standpoint, certainly it's important for an individual to get the proper evaluation by a medical professional before participating.
I wonder how often that really happens, though.
Probably less than should. You know, I see my fair share of divers in the office, and more times than not, the injuries sustained with diving are from common illnesses and medical conditions that just become more prevalent or prominent with the actual participation.
Because I would imagine that a lot of these people are, you know, it's a sort of an intense experience, so they get underwater and then their heart starts beating faster and their blood pressure goes up. So if they even had something ahead of time, it's going to be exacerbated when they're there.
Definitely, and that's common. That's a common occurrence, especially for the diver that doesn't participate quite as frequently as maybe others. And so, you know, so for someone that hasn't participated in, let's say, a couple of months to up to a year, the experience of descending underwater can cause certain side effects. Patients that participate in diving typically experience more pressure exerted on their bodies, which can result in ear injuries, sinus injuries, or more significant injuries.
All right, let's talk about some of those more significant injuries. And by the way, you can catch lobster at your local grocery store. And it's probably safer.
It is safer, and certainly, you know, there's a lot less risk with going to your corner market.
Whole Foods, yeah.
Exactly. But the thrill of being able to catch your own underwater life is I can certainly appreciate it, is very exciting.
Well, you know, you're, as a personal sort of anecdote, you're an avid diver and a skydiver.
Absolutely.
You know, if I may say this on TV, you're kind of a badass. So that's pretty cool. And you save lives, oh, by the way. And ladies, he's single. All right. So, by the way, you're welcome for all that.
Thank you very much.
So let's talk about some of the more serious injuries that you know, anyone from a novice diver to a really experienced diver can sustain.
Sure. Thankfully, most of the dive-related injuries are more minor, being what's called barotrauma or pressure-related injuries. Typical injuries such as ear and sinus squeeze, as it's referred to, usually needs the evaluation by a physician. More times than not, it's about you know, getting out of the water, allowing yourself to heal. Certain medications can speed up the process, and an evaluation prior to returning to the sport. But there are more significant injuries that can be sustained from diving. One in particular is decompression illness, which refers to the expansion of gases in the bloodstream and soft tissues. And those type of injuries typically need an institution with what's called a hyperbaric chamber available in order to receive adequate treatment. And the condition can certainly be life-threatening if left untreated.
Two-part question. How do you know you've had it? And when you're underwater, I mean, is there something that tells your body, like, it's time for me to end this dive immediately and get back up?
Well, signs and symptoms of decompression illness typically occur within the first 4 hours of resurfacing and getting back onto the boat. And there's a milieu of symptoms that can occur, anywhere from a rash on the chest and abdomen to joint pains, numbness and tingling of the extremities, and in more severe cases can result in dizziness, lightheadedness, stroke-like symptoms, and potentially fatality if, again, left untreated.
But how do you get it, and how do you prevent yourself from getting it?
Well, the best rule of thumb for avoidance of decompression illness is to follow your dive computer. Your dive computer is your lifeline. It will instruct you on how much time is available in the dive with the adequate time amount allotted for resurfacing with safety. More times than not, a decompression illness is due to ignoring your computer, going beyond the time that's allotted for a dive, ascending too rapidly, or not really having your equipment checked for its function, which should be done on a yearly basis.
All right, last diving question. I don't know if you learned this in medical school, but do you punch a shark between the eyes? What do you do if one attacks?
The good thing about the myth of shark attack with scuba diving is sharks are generally more afraid of us than we are of them.
Everybody says that, but still, they've got bigger teeth than we do.
That's true, and I think the reality is that as long as you can respect the underwater marine life and not get overly close, to be able to give a safe distance between you and the shark, you should be okay. Yeah. I've never really experienced a diver with a shark attack. A lot of shark attacks occur with individuals at the surface because they can confuse their prey with say a surfer or a swimmer.
All right, let's switch from diving to swimming.
Sure.
I mean, people swim down here, obviously.
Absolutely.
Any specific advice you'd want to give people on how they can avoid swimming injuries?
Well, swimming, especially during mini season, it can be tricky because boat captains and those that operate boats often can't see a swimmer from a distance. So it's really important when you're in the ocean to be able to A, dive with a buddy in case there's an emergency. B, ensure that you've adequately hydrated, because prolonged swimming can increase risk of things like dehydration, muscle cramp, and fatigue, and potentially can lead to drowning. And so a lot of the swimmers out there just need to use common sense. Stretch before swimming to warm up your muscles, and really avoidance of alcohol if you know that you're going to participate in swimming.
You would think that last one would be common sense.
You would think so.
One would think. Yeah. Well, we're out of time. If people want to ask you more questions, get a hold of you, how do they do it?
Absolutely. The easiest way to contact me is to call Cleveland Clinic at 954-659-5630, or you can go online to clevelandclinicflorida.org.
Easy enough. All right, well, thanks for coming in, and we'll see you again soon.
All right, thank you.
Take care.
All right.
Awesome. Thank you, Dr. Grobman. When we come back, find out what the Boys and Girls Clubs of Miami-Dade are doing to keep your kids busy, safe, and thriving throughout the summer. We'll have that for you when we come back.